like others, I want to raise the issue of direct provision. I think one of the things that we've been talking about is the importance of equality in this session, and I think one of the things that we will be judged on is how more vulnerable groups were treated during this pandemic. And I look at the infection rates with indirect provision, people living in direct provision, and they're significantly higher than the general population. And I think that's quite worrying. And we've seen, the scenes in Cahir-Savine show exactly the problems that are for many of the people living in direct provision. And the reality is that direct provision has been with us for quite a long time. And these problems that we are seeing were deeply predictable. And the slow pace of any reform, or the lack of any movement to reform, has made these problems worse. And as I say, not made them worse, but certainly made them inevitable. And look, I think we have to accept where we are and look at that. But the reality is that the Chief Medical Officer said clearly that sharing bedrooms with non-family members does not allow for social distancing. And it seems the HSE had a new definition of what a household was, allowing us to sidestep some of these public health concerns within direct provision centres. And again, the significantly higher infection rate for those living in direct provision compared to the general population is an inevitable result of that kind of sidestepping. So I think it's important that we look at those in direct provision and do what we can now as quickly as possible. And I think the creative solutions have been suggested before earlier today by other deputies, and I think we need to embrace those.